Hi, this is Adobe Okoye, and welcome to my platform, Nursing and Therapy. As the name implies, we talk about all aspects of life and therapy. Please relax, listen, and remember to share with your friends.
Hi guys, welcome back again to Nursing and Therapy. You know what we talk about anyway. So my name is Adobe Okoye first, and I have here with me Amaka, and I'll just let her introduce herself.
Hey guys, hello.
Okay,
My name is Amaka.
okay, continue. Yeah, continue. Continue.
Right. Hi, my name is Amaka. I'm not new on this channel.
Exactly.
Anybody that listens to Nursing and Therapy should already know me by now. I'm a favorite cheerleader of this brand. So, number one cheerleader. I'm a nurse. I live in UK. I am a mom. I'm a businesswoman, and I am also into lifestyle and healthcare stuff. Just I'm an ambassador of good life anyway,
I
generally.
was going to say that I know. Okay, so today let's just go straight to the point, and we'll try to be as brief and as fast as we can, just to save time. And today we're talking about postpartum depression or postnatal depression. And Amaka here is knowledgeable with regards to this topic. So she's going to talk to us about postpartum depression and then just share our views or opinions about this. So Amaka, I leave it to you. Postpartum depression, please start.
Right, okay. Just by a little way of introduction, in very simple terms, postpartum depression, literally, like it's a depression that happens during postpartum. So it's a mood disorder, and it's actually a major one, major mood disorder that happens during pregnancy and after childbirth. So because it's postpartum doesn't mean it cannot happen during pregnancy. It can also happen during pregnancy. So, like I said, it's a mood disorder, and it is characterized by major feeling of sadness, anxiety, being withdrawn, lack of interest in things that used to interest you, difficulty sleeping, thoughts of harming yourself, thoughts of harming your newborn. Like if you see someone who is depressed during postpartum, like it's just like this person is just so out of this world. She doesn't want to speak to anybody. She just like she just wants to be in a world of her own. They also feel like the world is against them and stuff like that. So, and the major causes of this postpartum depression, people usually say it's hormone changes during pregnancy and childbirth, but it's not just, it's a factor of a lot of things. So hormonal changes, yes, during pregnancy, because pregnancy is a long journey of 9 months. A lot has gone through your body, hormones, progesterone, estrogen, and all sorts of changes in the body. So this could trigger postpartum depression. But there are other things, like I said, which could be, say, someone has had depression earlier in life. If you've had depression earlier in life, let's say when you're a teenager, when you're just a youth, and at any point in your life you've had depression, during pregnancy, there is high chances that it could stir up again. And people that have had like major life events during pregnancy or during postpartum, like say they've lost someone very close to them, like the death of a parent, it could make postpartum period so difficult, and it could stir up postpartum depression. Then if you're in a very difficult relationship, if you're having relationship issues with your partner, it's also one of the, like say you're going through domestic violence, you have going through a financial abuse or any sort of abuse, it could stir up this kind of things. So, cause some time ago, I saw a random post on Instagram about a woman. So they say she killed her newborn child, and the comments on like what people were saying on the comment section, like it dawned on me that people are actually ignorant that postpartum depression is real, because they are saying it's spiritual. It's not spiritual. It's a major, the way we take high blood pressure during pregnancy, very serious diabetes. It's just a medical condition. But people are just ignorant with, especially in some underdeveloped countries and developing countries, everything is just spiritual. It's not. So the way they were bashing this woman, like I was like, hey, I wish they knew what this woman is going through at this point in her life. Bashing, insult, and all these kind of things should be the least thing she's supposed to be getting. She should be getting all the support she needed at that time,
if she had
So
the postpartum depression, yeah.
Mm-hmm. So because the reason they said was that she was going through a lot, her husband was not supporting her, she was being abused in the marriage, no financial support. I mean, it's just enough to make somebody go through depression, So that was her reason. And postpartum depression is so bad that it could make you think of like frightening thoughts of harming yourself or harming your newborn. That is why, as health professionals, we look out for these signs of postpartum depression, especially like if you're a midwife, because for developing and underdeveloped countries, it's just to go for antenatal and then boom, childbirth. But it's actually a journey. People need to prepare their mind psychologically before getting pregnant. You need to be sure that you're actually ready for this thing. Even during pregnancy, make plans for postpartum. Postpartum should not just be something that on your 9th month of pregnancy, you're not planning for postpartum. And then the healthcare system, we have a lot of work to do. Our nurses, our midwives, we have a lot of work to do. It's not just about physical check. You check out the mental state of pregnant women. It's at that point that you identify women who are going through any form of abuse in their relationships. It's at that point you identify people who does not have adequate social support, financial support. These are the things that we need to find out and look for any way we can. You don't have to support them. There are people who are responsible, like the social services and stuff. It's their duty. You find out the adequate support this person is going to need. So these assessments are actually very important during pregnancy. In Western world, they go as far as coming to your house to assess your home. They check the living conditions in the house. They check that when they come, they want you to have your partner at home. They try to assess the relationship between you and your partner. This guy's talking, what's going on. If there's a cold war between two people, you will definitely tell. So these are the things they look out for. Is the environment, you can't be pregnant and you are in an unconducive environment. You get what I mean? So the environment needs to be very adequate. Does this woman have enough support in preparation for postpartum? What plans do you have on ground? Do you have people who are going to support you after birth? So these are the things that people need to plan for, before thinking of getting pregnant and having babies. So postpartum depression.
I'm sorry, in essence, the whole postpartum planning or plans, should actually start when you're pregnant, not
before pregnancy, not when you're pregnant. Before pregnancy. So you have to
avail any sort of or any form of depression, right? Yeah,
yes, yes.
It's going to kind of prepare you, and more like control what you can control than the ones you can. Then you find a solution to it.
So you need to even for us here, I know a couple of friends who okay, now I'm ready for pregnancy. They go to hospitals, they get checked. While you're being checked physically, you're also being checked psychologically to be sure that you're mentally stable to go through the process of pregnancy, because it's a process, from one stage to the other. Do you get? So people need to start planning for these things before they actually get pregnant. So that is just about it. There are other causes of postpartum depressions. I've mentioned a couple of them. Social needs. If you are not adequately supported, it could lead to depression. So now, with all this being said, how do we prevent or how do we treat postpartum depression? Say it has occurred. The first one is to be able to identify someone who is going through this depression. And for people say postpartum mother, especially new moms, it's just overwhelming for new moms. So you need to seek help when you we know that you need help at this point. Oh, I need help. Speak up. You don't have to wait for things to get so bad before you speak up. If you're going through any form of situation at home, you need to seek counsel. There are talking therapies that are out there to help you. Some of them are actually free online. Some of them you can actually pay a token. If like in some of the Western countries, it's just free. You can access these services anywhere. Even if you don't have to pay a therapist, look for a friend. There are people you can actually talk to. Talking is therapy. Like it helps you to unburden a lot of things. It makes you feel better. So these are the things like in the advanced way, they could take it a bit further. Say this person might need like a CBT, cognitive behavioral therapy. These are things that could help during a postpartum depression.
Okay.
Again, the woman should do things that, like, if you know these things that used to make you happy before you got pregnant, say activities that you used to like, places that you used to love to go, you need to make out time, because the truth is childbirth and postpartum and everything that has to do with being a mom changes the trajectory of your life. So you have to just plan your life at this, but if not, you lose out on a lot of things. So everything needs to be properly timed. You have to actually create that time. The fact that you are a mom does not take away the fact that you used to be a person before you became a mom. So you need to look after yourself. Eat healthy. Exercise is also good for the mental health. You don't have to run in the gym. Take a walk. A walk, like when you're going out for a walk, it helps you to meditate. It helps you to think. It helps you to unburden things. Talk to friends. Make preparations in advance, and then in a very severe case, you might need some like medical treatments like drugs, antidepressants, and stuff like that. So I would also like to mention that postpartum depression, it's not just peculiar to women. Yes, women go through postpartum depression more, but while we are looking out for the women, we should also look out for the men, because the men are also parents. You get what I mean? So we should also, it's not just peculiar, because men tend to like absorb a lot, but we actually don't know what they are going through. So we need to encourage them to, if you're going through any sort of, especially for dads who like are actively involved in the care of their like children. So these are the things we need to look out for the men as well. And then all of this there are a lot of myths around postpartum depression. Like one of them is that it's spiritual. It's not spiritual. Some people think it's postpartum blues. It's different from postpartum blues. Postpartum blues is just like a temporary mental health state that is just temporary. It's not long term. Just emotional changes that happen within the first 2 weeks of childbirth. But postpartum depression is long term. So we should not get these things mixed up. So with that being said, we need to like create more awareness, let people know that postpartum depression is real, it's not spiritual, and they should be able to seek help when they are going through depression.
Okay. Thank you. Thank you very much. That was a good one, actually. Okay.
So,
Yeah, so to add to what Amaka has said, I'm just going to give a summary because I'm also learning. We're having a conversation and then I'm learning as well. Every other person out there listening and watching, they're also learning. So to put in my own words, I would say that in agreement with what you've said, childbirth and motherhood is like a different journey entirely, right? Sometimes it kind of changes some aspects of your life, things that you do, but well, some people believe that it changes them completely, but you just have to first accept it that this is
you have to make a conscious
yes,
effort to still be
yes.
yourself.
But then
You
there's
know,
this acceptance that this is a stage in your life or a phase in your life that you're here to face, right? And then with that mindset, you should be able to cope or deal with some things that come up with it, yeah, or come with it. Then talking about postpartum depression, it's like you said as well, it's something that mothers should or women should actually prepare for, like postnatal period, not the depression. The postnatal period is something that they should prepare for before they even get pregnant and while they're pregnant. To be honest, I'm learning this now as well. So it's not like it's only when you have a baby. Well, I know that they should be teaching things like this at the antenatal classes, but it's something that they should prepare for and have in mind that they should put things in place before childbirth. So talking about postpartum depression now, depression generally is a mental health condition. Now we're talking about the postnatal aspect of it, after birth aspect of depression. That's the postpartum depression or postnatal depression. So normally, depression is when you have symptoms such as you being hopeless, you kind of not enjoy what you're doing anymore, you don't want anyone around you, like maybe you get overwhelmed, you're crying all the time, a lot of things. And if it happens for more than 2 weeks, then that's when we can term it postpartum depression. So to give a difference between this post baby blues and the postpartum depression. Baby blues occurs when it has maybe usually with just 2 weeks after birth, the first or the second week after birth. You're kind of overwhelmed, you're crying all the time. You don't even know why you're crying, you're anxious, you're restless. But then it happens for just 2 weeks, right? And it's over. But when it passes, like when it's over 2 weeks, going to a month or more than that, that's when you can tell me postpartum depression. And the bad thing about this postpartum depression is that sometimes you don't even know that you're having depression. Generally, most times people don't even know that they're depressed. People know, but then that's why you have a partner. You have a partner to look out for you, and then you guys should just look out for each other. And like Amaka said, postpartum depression, it can also affect men. So while the man is looking out for the wife and looking after the wife and looking for symptoms or things that are unusual with the wife is also looking after the man as well. You guys are kind of supporting each other. Yeah, so that's just it. Then when it comes to the causes of postpartum depression, like you said, if you've had a history of, let's say, mental concerns, or even before pregnancy, at a younger age, and while pregnant, it could predispose you to having postpartum depression. And if you've got like a family history of, depression or some mental illnesses, it could also cause that. And also, I think some social factors, psychological factors, having relationship problems with your partner, these are the things that could make you depressed. These are the things that could cause some, postpartum depression. So looking at the treatment here, the goal of this or the aim of this podcast is actually to make you aware that you can speak to anyone. If something is happening to you, something that is unusual that you're not sure about, or like say your partner has noticed something that is not used to, like you're not used to doing, or these symptoms that we mentioned, like hopelessness, you feeling tired all the time, maybe you're eating too much or you're not even eating, like um or you just want to be left alone, yeah,
No,
low mood and not enjoying what you normally enjoy, like what you love to do, you don't even do it again. And if this keeps on going like for like more than 2 weeks, then the aim of this podcast, like I said, creating awareness, is for you to speak up, speak to someone. If you are not doing this speaking, then like if you're not the one speaking to someone, then your partner should be the one, who is looking out for you and then speaking to someone regarding your concerns. So now, if you don't have anyone to speak to who could advise you on what to do, you can just ring your GP and or even your midwife. In the developed world, they have midwives that come to the homes, like you said, um, to assess the women while they're pregnant and even after pregnancy. So you can let them know about your concerns, right? So they can do a referral, they can speak to your GP, and then they'll do a referral to the mental health clinic. Like you can do like talk therapies, or which you can do yourself, like it's self-taught sometimes, yeah. Or you can even go for the cognitive behavioral therapy, like Amaka said as well. And there are other things you can do. Don't forget, the first thing I said is speak up, because when you speak up, that's when people can help you. So if you're not able to speak up, your partner should help you to speak up. And then if you don't have anyone to speak to, like let's say you don't just want to ring your GP you're not sure, you can't just be telling your midwife. You can even say that to your friends, and your friends can advise you, hopefully give you that good advice. Then the second thing is eating well, exercise, try and rest as much as you can, eat good food, take a walk if you have to. You need to actually take a walk, and then try and live healthy, stay healthy. Then the last one is the antidepressants. That it's actually in very severe cases that they use the antidepressants, because if you are a mom, or when you become a mom, and if you are breastfeeding, because not everyone breastfeed, they'll put it into consideration, like, are you okay to take this medication while breastfeeding? And then they can now prescribe antidepressants, but that's in very severe cases when all these other options have been kind of done, and then it's not working for you. that's when they can give you some antidepressants, right? And then I don't know if there's any other thing. But regarding the men, it's not just about women now. We should also focus on the men, because men, they also come down with this, so they call it paternal postpartum depression, especially new dads, the ones that are kind of new to this, because they may be having some financial problem, some, maybe they are new to the role. They're actually new to the role, like being a dad and everything. So they might kind of be depressed, anxious, overwhelmed about it. So it's very important for the partners to look out for themselves and then speak up when they are concerned about things. I also want to mention that this postpartum depression can happen at any time, especially in the first year of birth. It mustn't happen in the first month. It can happen in the when maybe third or fourth month of birth. It can happen at any time, and it comes up gradually. Like, it's not like the psychosis that can happen within an hour. Like, sorry, within hours after birth. It doesn't come up immediately. It comes up gradually. So, and like I said, it mustn't come up 1 month after birth. It could just be there maybe at the 6th month of birth. Then you're noticing some changes, or someone is noticing it. Then something very important I want to drop here is, if you start experiencing that thoughts of self-harm or harming your baby, please act immediately, because you don't want to harm yourself and you don't want to harm your baby. So when that thought comes, thoughts of self-harm or you harming your baby, please seek help. I think, I don't know if there's something else you need to add. Is there something else you need to say? I don't know if I've been able to summarize everything to the best of my knowledge, and if you agree with me as well.
Well done. Well done. I just want to add one more thing. So, from experience, I've noticed there is this challenge some women go through, the fact that every majority of women in developing and underdeveloping countries, there's this pressure to do exclusive breastfeeding, right? So people need to understand that everybody must not do exclusive breastfeeding. I know a couple of women who have felt so bad about themselves that they could not do exclusive breastfeeding. I know a couple of women who have felt so bad that I could not breastfeed my child. Everybody cannot lactate the same. Do you get what I mean? Some people lactate so good, while some people cannot. You can't help it. It's not you. So people need to understand and stop making these things feel like it's just about them. And women tend to start feeling bad, especially when they go to antenatal clinics. Oh, I'm doing exclusive breastfeeding. Oh, I'm doing exclusive breast. It's just like a competition thing. Exclusive breastfeeding was brought because of hygiene, and like babies come down with diarrhea, vomiting due to inadequate neatness and maintaining proper hygiene. That is the main reason why this exclusive breastfeeding was brought. If you are able to exclusively breastfeed, do it. If not, don't put yourself under any form of pressure. I know why I'm saying this. From experience, I've known a couple of people who, because they were not able to exclusively breastfeed their child, they feel so bad. It makes them feel like, I'm not woman enough. I know a woman who was not even able to breastfeed. It's not your fault, for God's sake. Don't make this thing get to you or make you feel bad. This is a major thing that actually make women feel depressed, especially in that early stage. You can imagine a newborn, a new mom, or a woman who has just put to bed and she's struggling to breastfeed. It's a whole lot. It makes them feel so sad. It makes them feel like, oh, I cannot give my baby enough. It's not about you. Please get milk. There are a lot of good milks in the market that you can give to your child. Everybody must not do exclusive breastfeeding. Everybody must not breastfeed. If you can, it's recommended. But if you cannot, don't put any pressure on yourself. I know why I'm stressing this. I've had a lot of people who are struggling with this thing. It has to be breastfeeding. It has to be breastfeeding. It does not have to be breastfeeding. Just do whatever works for you. That is just what I want to point out. Thank you.
Okay, and I like that too. Yes, I like that. And well, you've said it all. Exclusive breastfeeding is recommended by WHO. Yeah, it's very good if you can do exclusive breastfeeding. But then, if you can't, there are other ways that you can help your baby. There are other ways. You don't have to put yourself into that pressure, right? There are other ways you can actually do it. So we're still talking about the same thing here. Speak to someone that is qualified. Don't just speak to anybody. If you have friends, good friends, speak to them, speak to someone about what you're going through, and something good should come out of it. They can advise you rightly. But then the best thing is if you have your doctor, like someone qualified to teach the person. So we've come to the end of this
Okay.
podcast. And I'm going to apologize for one thing. We've been having problems with the internet or the network, so it's kind of, I don't know. But I'm just going to apologize, and but we hope you guys enjoyed this video and this topic. We'll come back next time to give you something very important and very special as well. Thank you very much for your time. Please like, follow, subscribe. What are the words? Share, all of them. Share with your friends.
Tap, tap, tap.
Yeah, exactly. Tap, please. And I think you're nursing and therapy, and want to thank you very well for listening. I also want to thank Amaka very well. So Amaka, thank you very much for always coming here to rescue me. Thank you so much. I will come back again with something very good.
Anytime.
All right then. Amaka, do you have anything to say, or just say bye to them?
Bye.
Bye. So as usual, please ask your questions if there's anything. Bye. See you guys later. Bye.